Lyme disease. It's a worldwide concern, a silent epidemic that is rapidly growing every year. It knows no border, no nationality, no race, and no political system. The number of infected people worldwide continues to rise dramatically. Lyme disease is caused by the Borrelia burgdorferi bacterium, which is often transmitted by the bite of a tick, but infection can occur by several other means as well. Borrelia and other co-infections can be transmitted to humans by ticks, mosquitoes and fleas, sexual intercourse, blood transfusions, transplacental to fetus, breastfeeding, and unpasteurized milk. An infection with the bacterium and the other co-infections that come with it can cause severe and debilitating symptoms. Dr. Armin Schwarzbach, a specialist in laboratory medicine and CEO of Infectolab, a test laboratory for tick-borne diseases in Augsburg, Germany. Dr. Schwarzbach started working with Lyme disease in 2002.
The patients start all with neck pain, for example, headache, shoulder pain, muscle problems, weakness, chronic fatigue syndrome is coming then, multiple sclerosis-like symptoms are coming, Alzheimer's-like symptoms are coming up, and so on and so on. Each symptom is possible in Lyme disease.
Lyme disease is often referred to as the great imitator, as it mimics nearly 400 other medical conditions, often causing patients to receive an incorrect diagnosis. Carsten Nicolaus, general practitioner and CEO of the Borreliosis Zentrum Augsburg in Germany. The BCA's objective is to offer a holistic approach to therapy for chronic Lyme disease patients.
So we see a lot of other pre-diagnosed patients. So some of them got the diagnosis of MS or ALS. And so we see in around 5% of these patients that they were misdiagnosed, and they do not have these neurological illnesses. They have instead of these neurological illnesses, neuroborreliosis.
Neuroborreliosis, caused by Lyme disease bacteria infecting the brain and central nervous system, was also the case with the undiagnosed 43-year-old Dane Flemming Andersson. In 1991, he noticed a decline in his health.
First of all, the symptoms was, in the beginning, symptoms like having a influenza. And the doctors said that it was some kind of virus, and it will go eventually. So, of course, I believed in the doctors. What else could I do? So I waited until the symptoms will go. Unfortunately, it didn't.
Flemming was going through a difficult period. He became more ill by the day, lost 35 kilos, was unable to work, had no social life, and couldn't depend on the support of the Danish healthcare system.
I lost almost everything because I was only a person who could lie down or were at a hospital or were figuring out how to get well.
In his search for a cure, Flemming discovered several natural treatments for Lyme disease. One treatment that got his attention was the Cowden support program, developed by Dr. Lee Cowden, a board-certified physician in internal medicine, cardiovascular disease, and clinical nutrition. Dr. Cowden's desire to develop a treatment for Lyme disease began with the needs of a friend.
In 2002, a friend of mine brought her grandson to see me in Dallas, and he had been diagnosed with Lyme disease by a Lyme literate physician. He had been placed on large doses of pharmaceutical antibiotics by that doctor, and he got progressively worse. So when I evaluated him, he energetically tested very poorly to the antibiotic and energetically tested very good to the cemento herb. So I suggested that he change over to the herb. Without telling me or his grandmother or his parents, the boy on his own changed from the antibiotic to the herbal and got a whole lot better in 2 weeks, and in 2 months he was completely well.
4 years later, in 2006, the first version of the Cowden support program was introduced. Currently, it consists of 14 different products that are taken over the duration of 6 months.
The Cowden support program works on a natural basis on multi-levels. It eliminates the microbes, it cleans out the toxins, it replaces the nutrients that are deficient, and it cleans out the fibrin and the biofilm using the enzymes. Now, this is using drops for the most part that are taken by mouth twice a day. The drops initially that are started are the ones that clean out the toxins, and then adding in the drops that kill the microbes, starting at a low dose and building up slowly. And then after that, the magnesium helps to replenish the deficiency of the magnesium, and the enzymes help to clean out the fibrin and the biofilm. Now, this advantage of using the drops over pharmaceutical antibiotics is that the drops are absorbed in the upper gut, so they go into the bloodstream very quickly. They don't end up in the small and large intestine. The antibiotics that are usually used for treatment of Lyme disease do end up in the small and large intestine, kill off the friendly bacteria there, cause fungal overgrowth, and cause a problem with toxins being produced by the funguses in the gut that this natural program does not result in.
When I had the first drop, literally the first drop in my glass of water, I could feel that it was a very strong kind of medicine because it had a deep impact on my body. I had a reaction which I've never had before that. So just from 30 or 50 minutes. And this reaction is called a Herxheimer reaction.
Herxheimer reaction. It's the die-off of the microbes from taking the antimicrobial herbals. And this is expected, and it's actually a very good sign when that happens. It makes the patient feel terrible, makes the client feel very terrible, but it's very important for them to know that they are killing microbes.
2 years ago or 3 years ago,
Dr. Armin Schwarzbach was interested in the Cowden support program and was involved in a study.
Lee Cowden protocol, we did a study with it, and it's helpful for over 50% of chronically ill, very sick Lyme patients, and over 50% got improved by the Lee Cowden protocol. There's no guarantee for healing, but patients can get very good improvements under the Lee Cowden protocol, over 50%.
But the fact is that the Cowden protocol saved my life. As anyone can see, I add 35 kilos, and I'm now able to sit here and talk to you guys. That's whatever people say and think, that's a success story.